It is my singular honor to welcome you all to the 18th Ordinary Assembly of Health Ministers of the ECOWAS region. I consider the ECOWAS region as one of the most important and the West African Health Organization as a critical component of ECOWAS because of the direct correlation between human health and capital development, as well as wealth of the people. Indeed, health should no longer be seen as a resource-consuming sector, but a sector that contributes to economic development of every nation. In contributing to economic development, we should improve access to health without allowing for catastrophic spending. Similarly, we need to strengthen our health system to deliver high-impact interventions. Our focus at reducing the burden of diseases of our people should be unequivocal. This meeting holds to set out priorities to address the shortage of human resources through task shifting. Nigeria has already adopted a task shifting policy. It is no news that we struggled over the years with communicable diseases, but we are beginning to experience the high burden of non-communicable diseases, such as cancers, hypertension, and diabetes, among others. Unfortunately, there is paucity of data to inform our interventions. We must invest in collection of data to inform decision-making and implement feasible and evidence-based control programs for these NCDs at the country and regional levels. Another public health issue that will require a concerted effort is tobacco control. We must not be deceived by the economic gains of producing and selling tobacco and its products. The adverse health consequences of smoking far outweigh the economic benefits. We need to unite within the region to effectively control sale of cigarettes to underage, ban its use in public places, and enforce implementation of appropriate sanctions in order to promote the health of our people. Using surveillance data, we must plan ahead to control seasonal outbreaks of infectious diseases peculiar to our region. The regional CDC is well positioned to take off and address regional public health emergencies in Nigeria. And Nigeria will be providing infrastructural support for the regional CDC. In order to mitigate the impact of global shortage of vaccines, the federal government recently signed a memorandum of understanding with Mozambique for vaccine production in Nigeria. I believe this is a step in the right direction for our region. Furthermore, we need to develop plans for the local production of medicines for sustainability and our survival. On the management of disease outbreak within the region, the Ebola epidemic has reinforced what we already know, that our health and well-being as neighbors are intertwined. In addition, the wild polio infection in the Chad Basin is another learning opportunity for the region, as affected member states are working tirelessly to finally eradicate polio in the region. Therefore, we must adopt a sense of collective responsibility at all times, with each member state striving to collaborate and actively support the other. Before I conclude this welcome address, may I make a small but important observation that Nigerians' involvement in WOW activities and leadership responsibilities is not commensurate with our strategic position and resource mobilization. In this regard, I wish to appeal to member states to reciprocate the commitments of the government of Nigeria in ECOWAS by ceding more leadership roles to qualified Nigerians within WAHO. Your Excellency, the Acting President of the Federal Republic of Nigeria, the Director General of the West African Health Organization, fellow honorable members of the ECOWAS region, I'm aware that the agenda is loaded. I implore all of us to be committed to the implementation of the resolutions passed at this assembly. The local organizing committee has been constituted to ensure that we have a hitch-free meeting in Abuja. I therefore urge you all to have a pleasant time here. Our people are hospitable. You can enjoy all the comfort of one of the fastest growing cities in the world.